Welcome to the Health and Wealth Power Hour with industry expert and health insurance broker pro, Harlan Pickett. A show about how you can live longer with more cash and flexibility to really enjoy those years and never run out of money. Harlan will take your calls on a variety of topics related to health insurance, health care, retirement income planning, Social Security, thrift savings plan, 403b, 401k, or just about anything that gives you the tools to take action on keeping more dollars in your pocket and putting more dollars towards your retirement. He'll even share a few industry secrets if you listen close. And now, here's your host, Harlan Pickett.
All right. Thank you, everybody, for joining us again today. Boy, we got a great show for you. This is Harlan Pickett, Health and Wealth Power Hour. It is so good to be with you today. All right, couple things we want to hit on real quick. You are running out of time if you want your free silver plan. Free silver plan for the rest of the year for anybody that has received even 1 week of unemployment during 2021. You can get you a free silver plan and, of course, anything lower than that, too, which includes all the bronze plans. Get you a free plan for the rest of the year starting on August 1st. You have all the way until the 31st of July to sign up to make that happen. Just give us a shout over at Eagle Care. Go out to eaglecarehealth.com or, of course, give us a shout at 512-559-4358, and we can help you out. If you do not qualify for that, but you're still looking to join about 2 million other people and take advantage of the COVID special enrollment period, you have all the way until 8/15, that is August the 15th, to take care of that. Otherwise, you will have to wait until open enrollment, which starts on November 1st for a January 1 start date. Now, one of the things I also want to point out is some folks, of course, are taking advantage of the free COBRA. So you've got the COBRA plan going along here. You're getting a zero-cost COBRA. That's a wonderful thing. But remember, when your COBRA, your free COBRA runs out at the end of September, that does not mean you have a special enrollment period to get on to an ACA plan, because now you are voluntarily leaving a plan due to the cost, not losing a plan because you had no choice. Therefore, you really still have until 8/15 yourself to decide if you want to get a plan to start after that. You got to make that choice by August 15th. Reach out to us and we can help. Now, with all this free stuff, man, just why wouldn't you want to have one of those ACA plans? I mean, it's such a great deal, right? Free, free, free. I love free. Yeah, well, I mean, we all know the taxes are going to come due and we'll have to pay for them later. But right now it's free. And so why would someone not want to do that? Well, let me tell you a story of a gentleman that I talked to this week. Gave me a call. He was a referral, and he is facing liver cancer. Does not currently have a health plan, and he said, hey, I just want to go to MD Anderson. Who wouldn't want to go to MD Anderson? You get a diagnosis of something like that, that's where you'd want to go, right? You got cancer? I want to go to MD Anderson, especially if you're living in the Houston area. Why would you travel somewhere far away when you've got one of the 3 best cancer centers in the world right here in Houston, Texas? Well, guess what? There is not a single Affordable Care Act plan that is accepted at MD Anderson. Not one. If you have an Affordable Care Act plan, you will not be getting your care at MD Anderson. Unless, of course, you got a bunch of money in your pocket and you can pay for it yourself. Wow. So his next statement was, what else are my options then? Where can I go get treatment? Because now I can't go to the best place, so that means I got to settle. Remember, if it's free and it sounds too good to be true, it usually is. That means that you can get free coverage and you can certainly go get it taken care of. There's a number of hospitals in the area. Your HCAs, your Memorial Hermans, your Methodist, all of them across the board will take at least one of the options that's available on the Affordable Care Act. But none of them are MD Anderson. None of them will still give you really the same odds of beating that is MD Anderson. I talked to a lady that same afternoon that told me the story of her husband who had received treatment in the San Antonio area, and they got as far as they could. And they simply told her, there's nothing else we can do. We don't have the ability to do anything better than what we've done. All we can do is refer you to MD Anderson. Now, thankfully, the plan they were on at that time was accepted by MD Anderson, so they were able to go. But because the gentleman was in cancer treatment and couldn't work, he used up all of his sick leave, all of his disability, everything, then lost his job. Guess what else he lost? His insurance coverage. Because he was already in treatment, MD Anderson did make an exception and continued to treat him. They weren't going to turn him out and say, sorry, nothing we can do for you because your insurance is not covered anymore. But you know what? That is the exception and not the rule. They're not going to begin treatment on you if you don't have coverage that is accepted at that facility. And if you don't believe me, I highly recommend that you go out to MD Anderson's website and look under the insurance tab and continue to scroll down until you read the statement, just like I did, that they accept no plans in the state of Texas that are part of the Affordable Care Act. Now, as we've talked about on this show before, this is not an unusual situation. It's becoming more and more common that doctors and hospitals are not accepting plans that are ACA plans simply because they don't get paid. The prices are, there's just so many things. Going through the whole process of getting all of the paperwork in right, the additional things you have to have for that, administrative, it's just such a pain for them that it's become not worth taking those plans. But folks, there are options out there. There are options to make sure that your family is not caught in that situation to where you have to settle, where you can actually get the care that you need and deserve because you didn't settle. You didn't have to settle. You were able to make choices and go to the place you wanted to go to get the coverage that you needed and you deserved. But you know what? Folks have just got lost in this dadgum free stuff and this discounted stuff. They just want to get everything for free, and you're just not going to get it. That doesn't mean you have to pay a mortgage payment for your health insurance to get that kind of care either. I mean, what we designed with Eagle Care Health Solutions are affordable, truly affordable options, and you can choose where you want to go and get your care. You can choose where to get your care. You're not locked into a network of doctors that won't spend time with you and really don't care about anything but getting paid. They're not concerned about your outcome because it's all about the numbers. And to be honest, there's a lot of doctors that would love to get out of that. They would love to break free and get out of that churn that is going through all of the things they have to do to be part of that network, but they don't even know how. We're going to talk a lot about this today. I've got some special guests with me, and we're going to talk a whole lot about benefits, and we're going to talk about the options that you have, and that maybe it's time for you to shake stuff up. There's not going to be change unless we start it. Harlan Pickett, Health and Wealth Power Hour. Be right back.
Whether you're an individual or a business owner, Eagle Care offers health plan payments around half of what most are paying in traditional insurance premium plans. Plus, you'll have the control to choose providers from one of the best provider networks in the nation.
During COVID, we had great coverage for our whole family. The day I signed up, we had a welcome call, and it was so personal and genuine. Plus, we went from $1,500 to $690 a month with Eagle Care. Thanks.
That is the Eagle Care way. Reclaim your freedom to choose and soar high above the rest. Find us online at eaglecarehealth.com. Eagle Care Health Solutions. It's not insurance, it's better.
Money Matters with Steve Drake.
Hey, Dennis. Hi, welcome to KSCV. Good morning.
Hey, I listen to a lot of talk shows all over the AM stations, and I wanted you to know that you are by far the most creative, informative talk show I listen to. I'm one of your 100 very loyal
Oh, my
listeners.
gosh. That's so nice. I'm honored you listen, and I'm flattered by your compliment. Thank you.
Weekdays 11 till noon on AM 700 KSEV. Want to be part of the conversation? Phone lines are open. Call now, 281-558-5738. That's 281-558-KSEV.
This is Harlan Pickett for Eagle Care Health Solutions. Because of the American Rescue Plan, you may qualify for reduced health insurance costs or even a zero premium. Let us help you secure your savings by taking action now. Just contact us here at Eagle Care Health Solutions, online at eaglecarehealth.com. We know getting good, affordable coverage is hard. Eagle Care makes it easy.
Don't miss your chance to reduce your health insurance payment. Government estimates $50 per person per month savings. Go to eaglecarehealth.com.
All right, and we are back. Health and Wealth Power Hour. Hey, thank you, Gary, for a little bit of ZZ there, buddy. Yeah. Rest in peace, Dusty. Gonna miss you for sure. One of a kind, no doubt. That little old band from Texas was one of a kind. Dusty was one of a kind, too. It was really sad hearing his passing. Let the show go on, though, guys. Let the show go on, as he would want it to. All right. Free stuff, man. We all love some free stuff. I love free stuff, too. I love free stuff as much as the next guy. But, you know, I guess we all get to a certain age when we realize if it's free, it probably ain't going to be all it was cut out to be. Yeah, I always love the sign. I'm sure everybody's been to some place that you walk in the door and it says free beer tomorrow. Well, every time you walk in, the daggum sign says free beer tomorrow. I still ain't got my free beer. But today we're getting free health coverage in many cases, and guess what? It just doesn't stack up in many cases, and almost in every case. It just doesn't stack up to what you could get if you spent some time and effort to look at the options that are out there and you were willing to do a little shopping yourself. Yeah, you know, we've discussed before why price transparency doesn't work. It's because no one will shop. No one will actually look for what's available out there, and that's a real shame. Next week, we're going to be live out of Plano, Texas, at the Free Market Medical Association's National Convention, and have the folks that really started that whole movement here a number of years ago. We're going to be there remote and have them live next week, and I'm really looking forward to that, because while we have all these great ideas, we always work better as a team, as a group. And joining me today is Mr. Will Strother and Mr. Michael Strother, and, of course, Nicole Stanley, my old friend that likes to come slide in here every now and then. And we're really going to have just kind of a round table discussion about a lot of the things that are happening in the benefits world. And, of course, we do have our retirement income specialist, Mike, and we have our Social Security expert, Will. And so if anyone has any questions, wants to call in with any of those questions, we'll be happy to answer those too. And don't forget, you can always call us at 281-558-5738 with any questions you may have, or if you want to add something to what we're talking about today. But the reason I wanted to have these guys on is because they really saw the vision that we had with Eagle Care, and they embraced it. They embraced it and said, let's do it. Man, I love what you're looking at. I love what you're doing. Let's do it. And so they became a huge sponsor and a huge proponent of what we're doing and helped build this. We've been at this now, the whole building process and getting it rolled out for over 3 years, and they have never looked back. They said, wow, every time we added something else, they were just, man, this is incredible. And the fact that we can do this now for FESA, and FESA being a pretty large company, having over 100 folks with them now, but guess what? They're all 1099. But they're able to offer benefits to all of their folks, all of their 1099s. Who does that, Will? What kind of craziness is this, man?
It is crazy, Harlan.
But you know what? You've made a very interesting comment to me. We just started offering these benefits just in the last few months, right?
Right.
And you said something, And you were actually talking to Nicole, but I overheard you. Zero turnover.
Zero turnover.
Since you started offering benefits.
Without a doubt. Now, that's outside of our marketing world. Insurance is a tough business.
Yeah.
People come and go.
Yeah.
But what we're seeing, the people that are really good, they stay around because of the benefits, because they can go anywhere else and get a comparable contract, but they don't have benefits.
Right.
So it not only helps us attract people, it helps us keep people.
Absolutely.
That's been one of the interesting things is we have talked to folks that are coming on board once they get to the point where they qualify for benefits, and we were able to talk to them about the benefit. They're looking for that loophole, right? When they're talking to us, well, what exactly can I get? Well, what is this? This is they're expecting just not what we're showing them. Whenever they look and see the robust suite of benefits that we're offering, they really almost can't believe it. They are
amazing.
Shocked.
It really is. And we really can thank Obamacare for this, because their program was so bad. They shot the prices up so high that here comes American ingenuity, real entrepreneurs. And we've changed the landscape. And that's what Eagle Care is all about. So we not only can help 1099 people, but often with a W-2 person, Eagle Care is a better choice also.
It almost always is.
Yeah.
Almost always is. And, one of the things we talk about 1099s all the time, but you do have those companies. So let's just say FESA was a W-2 company, then you would be required to have insurance.
Right.
Right? Well, guess what? We have options through Eagle Care that meet those requirements.
Yeah.
And what a lot of individuals don't understand that own a company is they say, okay, well, I have to offer this plan. But guess what? No one actually has to take it.
Right.
That's an interesting thing a lot of folks don't think about. You have to offer a qualified plan. But what we're seeing more and more is those companies offer it. And so let's just say you have 55 employees, but only 14 of them can afford it.
Right.
So less and less people are taking the plan. So are you really offering benefits at that point?
Correct.
That's an excellent point. If no one's using them, then are you really making them available?
Right.
And you're really not. You said no one can afford a mortgage payment for their health insurance. That's really what's going on now.
It really is.
And Eagle Care is slicing that in half or more or less, however you want to say it.
Right.
And by the way, Harlan, I'd like Mike to touch on really what got our interest in benefits a long time ago, and then touch on the great role you and Nicole have played in building Eagle Care.
Yeah, and after that, I also want Nicole to share her situation. She has an incredible testimonial of what she's faced when she's been on Eagle Care compared to what her ACA plan did. So, Mike, we'll go to you first and talk about how y'all really were interested in offering benefits to begin with.
Well, when Will and I had the vision, if you will, of establishing FESA, which is now amazing, well over a decade old, we wanted to build a company that was unique in the 1099 world, if you will. We wanted to provide a company that would be Class A, providing not only health benefits, but providing life benefits, 401ks, or the equivalent of. So our genesis from initially was we wanted to build a company that was special with special people. So several years into it, Nicole actually came to us and said, hey, I'm starting to work with credit unions and with FESA, and they could use a benefit like a health benefit. So what do you think about building a health benefit? And we wanted one for the company anyway, and then she reached out to you, Harlan, and the rest is history, so to speak. And, we're seeing great growth with Eagle Care. But in all truthfulness, when we look, like you were talking about the free options that, you need to look behind the door, so to speak.
Yeah, what's behind the curtain, right?
Look behind the curtain. What we wanted to do was provide nothing but high quality. So we're a recipient ourselves of Eagle Care, not only the sponsor, but we also use Eagle Care for everyone working with us. Like Will was saying, it literally has eliminated, to a great extent, turnover in the non-sales side. And so we're personally experiencing the strength and the bond that small business people can have that right now may not be providing any benefits, but they can now start providing benefits like this through Eagle Care and watch their employment turnover reduce.
And that is very important. And one of the things I want to point out to everybody is when we talk about benefits and the full suite of benefits, we really mean that. What Eagle Care can offer and what FESA is offering all of their 1099 folks is a health option, and actually a number of health options through Eagle Care. Mm-hmm. They're offering supplemental benefits through AFLAC. They're offering life insurance, disability, short-term disability plans. Mm-hmm. We're offering all these things, dental, vision, and this is all possible not just for 1099, but of course for W-2.
Right.
It's the full meal deal, as it were. We're not talking about some stripped down, oh, look, you got something here. You know, yeah, we threw you a couple of quarters that direction, and, you know, look, we hope for the best. And on top of that, we're always adding more.
Well, the side note is, most people don't realize, on the federal landscape, 50% of the workforce are now, you know, contractors. 1099.
Right.
And I mean, I think that was my biggest discovery as we, you know, one of our main niches, you know, to start off with. We've definitely we've bursted out into lots of different fields in a good way. Have used that service that we had for federal employees and now are doing it for the individual, but had no clue. I mean, everybody just assumes, oh, well, you work for the federal government, you're all taken care of. Well, now we're getting to take care of them.
Right.
Right, and that's been one of the things that we saw, because I had traveled with you, Nicole, to a couple of different conventions just to ask questions. I mean, I was just fact finding, really, as we were building Eagle Care, and here were folks from all over the country that worked for the federal government telling us our biggest problem is the same exact problem that the local AC guy has and that all of you guys have out there that own a small business. They could not attract and keep good employees. Right. They'd finally get somebody on, get them all trained up, see that this person was going to be, man, this guy's got great potential. You know, maybe the person I'm talking to was a postmaster, and he says, one day I could see that this kid was going to take my job. When I retire, this guy was going to be able to step into it. It was going to be a great relationship for years. I really liked everything about him. 4 years into it, he couldn't stay anymore. He went to work for Walmart as an assistant manager because they had benefits.
Yeah, you know, another aspect to that, people get trapped in jobs. Rather than having a career, rather happy and going to work, they're trapped there, at least they feel they are, because they don't want to lose their benefits.
They don't want to lose their benefits. You're exactly right, Mike. Yeah. You know, I was in that situation long ago, working right here in the Houston area. Worked for HL&P back whenever there was an HL&P. Once we had deregulation, after a few years, they decided they didn't need my services anymore. And let me tell you what, it was the greatest thing that ever happened, because it set me free to be the entrepreneur that I really wanted to be, but couldn't afford to be because I couldn't leave those benefits, Mike.
Right.
I couldn't walk out the door. They had to push me out the door, and it's been the best thing that ever happened to me. But I couldn't take that step. I was trapped in that same pretty much dead-end job, and I see it. I see it happening out there. But we also know that right now more people are quitting their job than ever before. Mm-hmm. Those numbers are staggering when you see how many people are already looking, or how many folks out there, companies are looking to hire people, but more people are quitting. They're discontented with the workforce style, with the benefits that they have, with the management styles that are out there. They're discontented with that, and they're finally saying, I'm done. To hell with it. I mean, I know that some folks say it has everything to do with how much you get if you're on unemployment. But if you quit your job, you're not getting unemployment. So it has nothing to do with that.
Right.
It has to do, in these cases, with people being discontent and just done. They're just done with being treated this way. Time for a break. When we come back, we're going to carry on. We welcome you to call in and join the conversation. 281-558-5738. Health and Wealth Power Hour. Be right back.
Got FESA? That's the Federal Employee Service Association. Find out what FESA can do for you. A recent client had this to say.
Joy took what felt like a 12-lane highway heading off in all different directions, and it turned into a single-lane country road. Feels like my first breath of retirement, and it feels good.
This is Harlan Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
From annual checkups to managing chronic conditions, taking care of your health should always be a priority. At Houston Methodist, our primary care doctors are available to provide personalized care for you and your family safely. We offer a variety of convenient ways to get care from us, from same-day sick visits to extended hours at select locations. And we are taking every precaution to keep you safe during your visit. Choose your doctor or schedule online at houstonmethodist.org/stayhealthy.
Got a question for Harlan? Phone lines are open now. Call 281-558-5738. That's 281-558-KSEV.
This is Harlan Pickett for Eagle Care Health Solutions. Because of the American Rescue Plan, you may qualify for reduced health insurance costs or even a zero premium. Let us help you secure your savings by taking action now. Just contact us here at Eagle Care Health Solutions, online at eaglecarehealth.com. We know getting good, affordable coverage is hard. Eagle Care makes it easy.
Don't miss your chance to reduce your health insurance payment. Government estimates $50 per person per month savings. Go to eaglecarehealth.com.
Hi, this is Michael Miller. Join me this weekend for the Backyard Bay radio program, now at our new time, Saturday mornings at 9 a.m., right here on AM 700 KSEV, The Voice.
And we are back. Health and Wealth Power Hour. Your host, Harlan Pickett. Thank you for joining us today as we talk about the state of benefits and health solutions here in our country and the changes that we are working to instigate with Eagle Care Health Solutions. One of the very first folks to embrace, in fact, as Mike said earlier, the one who really said, hey, is there anything you can do? Because she had been on ACA and had certainly not had the best of experiences with it, is Miss Nicole Stanley. And Nicole, your story about what happened in two separate instances, one ACA, one Eagle Care, is certainly an inspiration of what is possible if people want to take control of their health care.
Absolutely. Absolutely. So, just the background story, I'd come from a position where I had United Healthcare at zero deductible. Even that, I still got bills, which was interesting. Like somehow, you'll be having an anesthesiologist that's at Methodist Hospital, and somehow he offices at Methodist, but for somehow his network is off in Timbuktu,
right.
And then you get this lovely bill of $3,700. You're like, where the heck did that come from?
Right.
So, let's start off with that, because everybody's dealt with that, even on the what they consider the, Bentley of the world. So anyway, but yeah, so I had to have a orthopedic surgery done, and basically they told me it was going to be $15,000 out of pocket. Now, I was already paying a pretty good amount of money to be on the ACA, because I wasn't getting much of a tax credit. I'm a professional. So, but still, it's still a big hit in your pocket. I mean, you're paying anywhere from $750 to $1,200 a month. Like you said earlier, that's a mortgage payment.
Right.
And I was a single mom. I had a daughter in college. Every once in a while I'd throw a few little pennies for gas and everything to my other child. So, it was a lot. And I was coming out of a divorce. So, there was a lot of different moving parts financially going on. And there's a lot of people that are listening here that can really relate to that.
I'm sure there are, yeah.
For sure. And so, interesting enough, like I said, it was $15,000. I thought, well, they don't even know, with my surgery, I don't even need to have physical therapy. I had a hip replacement, okay? There was no physical therapy. Well, the reason why is because my insurance on ACA didn't approve that physical therapy.
Wow.
So, I was paying out of pocket, to go to Orasti. And, and then also, luckily, I had landed in the right career and support. and had a little bit of help from my company to kind of get me through that crazy patch. And so it just made you think a little bit, you kind of joked that I was kind of like the first, most people would call that the guinea pig.
Yeah, that's right.
But, as I kind of sift through it, it really is. I've been treated like a thoroughbred because of the way that Eagle Care is structured. It's not going to be perfect, but it's pretty daggum close. And that's pretty awesome. So, then you fast forward 3 years later, and after Ice-Mageddon, right after, I think it was like 2 days after, I ended up waking up in, middle of the night and had to kind of get my daughter to say, hey, we're going to the emergency room. Went over to Methodist, and, they ran a huge battery of tests because the alarms were going off. And I had an MRI, I had a heart scan, I had my first lovely COVID test.
I remember the story
yes,
about that.
Nurse Ratchet. Yeah, will not ever forget her face.
You had a nice brain swab.
I think I remember the doctor's face that was next to the nurse more than anybody. He was absolutely horrified, but that's all good. And then they ended up putting me into a room over in Jones Tower for almost a day, and kind of figured that what finally happened, I was just dehydrated. But, we talked about this before. My IV was like $4,700, and all it was an IV.
Yeah. Saline.
I go and get, vitamin C and zinc IVs from, Restore Bounce Hydration, and they're like $150. So it's a huge difference. We've talked about that pricing before. But the interesting thing, and I shared with you the bill, was when I came back, my only out-of-pocket was $442. Well, I can handle that.
Yeah.
I mean, daughter's graduated, thank goodness.
Yeah.
But, it's such a relief. And it also changes your whole mind frame with your work thought. And when you don't have the worry and stress, your production stays much better anyway. So there's just so many different components that can happen. And besides, I'm a great testimony. For goodness sakes, I'm on one of the ads. So.
Right, and I think one of the things people really need to understand is that's not what was billed. What was billed for you was much higher than $400+.
Absolutely.
But what happened is, through the Eagle Care program, we were able to get that repriced and negotiated down to what it should have been.
Mm-hmm.
And while a lot of folks would say, well, I think the out-of-pocket on your plan, if I'm not mistaken, your IUA is $1,000.
Correct.
Okay. And so let's just say that her bill would have been $4,700. Well, okay, if it's $4,700, it still only cost you $1,000, right?
Right.
So that's a pretty good deal. Well, then why did we go through all of the effort to get it down to $400? Because then that saves everybody, right? It doesn't. We still didn't want you to pay for the $1,000.
Right.
If you didn't need to pay $1,000, then why would we want you to pay $1,000? And it also shows you how overpriced everything was to begin with.
Without a doubt.
And that is what we're facing. And it's unfortunate that so many people will not do what Nicole did and will not have somebody on their side like Eagle Care to make sure you're getting the best deal. Because if you're, let's go back and think about the plan you had with United Healthcare that was a zero deductible.
Right.
Well, you didn't have to pay that deductible, did you? No, because it was zero.
Right.
But you still had a big giant bill because stuff was out of network.
Right.
Did they help you with any of that?
No.
Did they negotiate that down for any of you?
Not at all.
No. Did they care?
I would probably guess no, not at all.
Well, they weren't paying anything, were they? So why would they care, right? That was on you.
Yeah, exactly. So.
And unfortunately, those companies simply don't care.
Right.
And one of the reasons, or one of the things I think is really funny is people think, well, the insurance company wants to pay as little as possible, right? Mm-hmm. That would be logical. I want my rates to be so low that I'm paying as little as possible. Well, guess what? They don't. They actually benefit from the rates being higher. Can you imagine why that would be?
Yes.
Why? Tell me. Do you think you know?
Yeah, the premiums.
That's actually not it.
Is that, what is it?
It's Obamacare once again. Guess what's written into Obamacare? It's written into Obamacare that they can only make a certain percentage. Let's just say 3% all they can make profit is 3%.
Oh.
Right? So if their prices are higher and they have to charge then higher premiums and they charge more, is 3% on $1 million or 3% on $10 million a bigger profit?
Right. Another problem with Obamacare right there.
Well, so the insurance companies want the prices to go up and want the hospitals to charge more because they're willing to pay more, because that's how they make their money, is they need to pay higher prices because that's how they make more profit. It's such a crazy deal. We're not talking about the set prices of Medicare and such now. We're talking about Obamacare itself.
Right.
And now we're also talking about why that goes right back into why so many hospitals and doctors do not want to accept some of these plans, because the pricing on Obamacare plans is different than the plans for your group insurance, for your Medicare, for all these other things. The prices are different. They charge different amounts because they benefit for the prices being higher. Well, no one benefits in that deal, right?
No.
I mean, now we know that all the time we see people that have a deductible of $8,550, and that's all they're able to afford is that type of plan, and then they're terrified to go to the doctor because they don't have $8,550 to pay if they find out something's wrong. So they won't go if they're sick, and then a lot of times they won't even go for their annual because they're afraid they'll find something.
Right.
Well, I had to take a survey today on Facebook asking about COVID. You know, have I not gone to the doctor because I'm afraid that I couldn't afford something?
Right.
So it's obviously out there. It is a worry out there.
Absolutely it is.
And it's probably, adding to the numbers because people aren't going to go
Right.
get
Well, there's no
healthcare.
doubt. And I think that's actually one of the prime reasons why we've seen telemedicine just skyrocket, is over 700% in the last 18 months now, because people have said, well, I'm not going anywhere, but at least I'll call a doctor and tell them this is happening, which is great.
It is a good thing.
At least they're talking to a doctor, right? That is that's a lot better than putting your head in the sand and just hoping for the best.
Right.
Because I think we got a lot of ostriches out there right now. A lot of folks doing the ostrich thing and just pretending like if I don't see it, then it's not happening.
Right.
Well, I utilized it on Eagle Care too, the telemed, and it's awesome.
I have too. It's awesome.
I mean, and it always resolves itself. What I needed resolves itself. I mean, you get good care over the phone, and it's FaceTime too. Mm-hmm. So I mean, they're touching, feeling, seeing, and they can even order tests. I've had some blood work done.
Yes, absolutely, and they can even write prescriptions a lot of times. Yeah. I mean, they can't write you narcotics. They can't get you your opioids, so don't even try. Okay, but they certainly can do a lot of things for you. They can. I mean, we can even do through Eagle Care. We do dermatology visits through Teladoc, which is pretty daggone cool. Yeah. More on that story of the gentleman that we talked about earlier that had cancer, went to go to MD Anderson, is not going to be able to because of his Obamacare plan. But the gentleman that had referred him had been telling this guy for months that he needed to see a doctor because something wasn't right, and he wouldn't go, and he wouldn't go, and he wouldn't go, and it's because he knew something was wrong, and he just wouldn't go. He finally did and was diagnosed, and $5,000 later is what his bill was to get diagnosed with it, and then he had no coverage. Mm-hmm. So all of a sudden, I need to find something, right? Well, who wants to be in that position? Mm-hmm. But now, because he didn't take action beforehand and get on a program such as ours with Eagle Care, he doesn't have that freedom to go to where he really wants to get treated. He's got to settle for somewhere else. Now, I certainly wish him all the best, and I hope and pray that they're able to take care of him at the hospital that he chooses. I believe that they've caught it early enough that he has a really good shot of full recovery. But we're really talking about he still doesn't have the choice of where he wants to go, to the place that he desires to go, because the condition that he has is something that he wants to have treated at a certain place. All right, it's time for a break. When we come back, we're going to put a bow on this gift, guys. Y'all stick around. Harlan Pickett, Health and Wealth Power Hour. Be right back.
Got FESA? That is the Federal Employees Service Association, and they've been assisting federal employees and the private sector with their retirement benefits for more than a decade. helping you understand your benefits, ensuring that you are not paying for benefits you don't need, and that you will receive the largest retirement check while paying the least in taxes. That's what FESA can do for you. A recent client had this to say.
Joy took what felt like a 12-lane highway heading off in all different directions, and it turned into a single-lane country road. Feels like my first breath of retirement, and it feels good.
This is Harlan Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Want to be part of the conversation? Phone lines are open. Call now, 281-558-5738. That's 281-558-KSEV.
This is Harlan Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Catch Chris X Radio weekdays at 4, right here on AM 700 KSEV.
After attending the Nerd Convention, aka Comic Palooza, and then tweeting out a pic of her not wearing a mask with a couple of stormtroopers, Lockdown Lena is back raising the COVID threat level and telling us all to wear masks again. In her Star Wars costume, she looks just like a kid and manages Harris County like one as well.
Chris X Radio, weekdays 4 till 6, right here on the Voice of Texas.
Eagle Care health plan options are about half of what most are paying for a traditional insurance premium plan. Plus, having control to choose providers and real help getting your health needs met at the most optimum outcome.
Reclaim your freedom to choose. Soar high with Eagle Care. Find us online at eaglecarehealth.com. Well, that's one thing we ain't got, folks. Welcome back. Health and Wealth Power Hour. We ain't got too much time on our hands. I'm going to wrap this up with a bow for you, but I know you're sitting out there today saying, man, I'd love to help my folks out, but I simply can't afford to add anything else to the bottom line right now. I just can't do it. Well, guess what? You don't have to. We can help you even if you don't want to put a penny towards those benefits. I ran some numbers, looked at what the options are, and you can offer a health solution that includes preventative care, prescription drug coverage, and when I say preventative care, not just their annual, but also mammograms, colonoscopy, immunizations, has Teladoc, has mental health wellness, and dermatology, plus dental, vision, hearing, and a couple of supplemental plans like accident or critical illness. You can offer that to your employees, and the cost would be less than $80 a week for those employees, and that's if they're footing the full bill.
Harlan, less than 80.
Less than 80, Will.
It's a heck of a deal.
And that's if the employer doesn't want to contribute a penny. And they have that option because if you have less than 50 employees, then you don't have to offer benefits. It's voluntary. And so you're truly offering voluntary benefits to all of your folks. And so you don't have to contribute at all. Certainly you could do so. You have that option to do so, just like FESA has opted to do so. But at the beginning, you were not really offering a whole lot.
That's
true. We
true.
won't have to get into numbers, but you weren't offering a whole lot. But you were shocked at what you could offer for that little bit you were contributing.
Without a doubt. And you know, we addressed this earlier with Nicole. It's not just the premium, but what you're out of pocket when an incident really happens.
Right.
And so you got to take everything in consideration. No, we were so excited to add Eagle Care as a benefit for our 1099ers. By the way, our entire company is 1099, including me. We have offices in Austin, downtown on Congress Street, but none of us go there. We work out of our house. We have a talented group in the Philippines that works with us, And so we're a small company, a little over 100 freelancers, but we wanted to bring them benefits. We wanted to, we talked about it, the ostrich burying his head. These people are hiding in the dark because they don't think they can afford something, or they just don't know who to trust.
Right.
Well, what Eagle Care did when it was developed, it offered us a real solution that we could be different than the other people that are in the financial world.
Right.
So you got your big New York Life and companies like this where you work straight for that company, and they do have benefits.
Right. Absolutely.
But then the majority of the financial industry is made up of entrepreneurs.
Right.
And people that are considered independent marketing organizations or general agencies. Well, that's a 1099 organization, and they don't have benefits. So we are literally first, as far as we know,
correct,
changing the landscape. And we think there's going to be a lot of followers because it's good for the people, and it makes it good for the company. So when we first started, we just wanted to make it available to them. And we gave a little bit of a stipend toward it. Well, now we've graduated. We've seen all the great benefits. And so we're paying up to $450 for every one of our freelancers. And by the way, because Eagle Care is so wonderfully priced, that's a Cadillac program.
It is.
At $450.
It is.
And so we're excited. But this is the main thing I want to get out to the small companies, whether you're W-2 or 1099, you can offer a great health solution, and it actually costs you $0 out of pocket. But you're making it available to them. The education, the support, the way Eagle Care is on your side. Because once you do go into cancer treatment or whatever, that's a cold place. I don't care if it's MD Anderson or anything.
Absolutely.
Who's on your side? Eagle Care.
That's right. Yes, sir, we sure are.
And let me give you an example. We recently did a recruiting. We're in the middle of some recruiting right now. And we placed ads in the national advertisers. And in the first 2 days that ad ran, because we listed what we offer, the position, and we listed all the benefits that we provide. And in the first 2 days, we had over 2,000 applicants. I'm not kidding, over 2,000. And we're blessed to have that. But the point here for all of the small businesses out there, that it attracts people.
Absolutely.
And by able to give the type of quality care that Eagle Care provides, you feel good about what you're doing. You feel really good that you are providing true, cost affordable health solution, health care for the people that are working with you.
Well, and also remember, let's go back to my experience.
Mm-hmm.
That's saving me $800 a month, even if, I did not have an employer that was paying my $450.
Right.
I mean, that's amazing.
And let me kind of give you guys another scenario that happened just this week. I had a company here locally in Houston reach out to me. I just talked to the lady yesterday, in fact, and she said, we don't have a lot of employees. We got less than 15 employees, but no one wants to take the Blue Cross Blue Shield plan that we're offering because it's too expensive. Mm-hmm. And it's going up again. What can y'all do? Well, first of all, we can offer a replacement of that by offering Eagle Care. But you know what else we can do? Something most companies cannot do. We can run that with the Blue Cross Blue Shield. Let's say that you have a couple of people on that they just want to stay with it. I mean, they're not going to change off that Blue Cross Blue Shield plan for whatever reason. Well, you can also offer Eagle Care as another option. So those folks could get Blue Cross Blue Shield, and the rest of your folks, or some of those people, as long as it's just two, we got to have two for a group, then could be on Eagle Care. So you have a greater opportunity to provide coverage to more of your employees by offering Eagle Care along with traditional. Now, we can certainly do both. So we can facilitate. We are a brokerage, so we can do those plans too. Blue Cross, United Healthcare, all those guys. We got all of them. Mm-hmm. But we're not going to try to take the place of your broker if you've got someone you like. But we can work with your broker to offer Eagle Care also. Want to make sure people understand that. If you're not ready to make that big jump, I think you'll change your mind after you're about a year on Eagle Care, and next time it comes around, I think you'll be ready to make that change. But if you want to just dip your toe in, we're fine with that too. We're fine with showing you. We're gonna let as I had taught my son growing up. Hope he's listening today. Actions speak louder than words, and we can sit here all day and tell you, yell it from the top of the mountains how great Eagle Care is and what we can do for you. But if you'll give us a chance to show it, that's what makes the difference. That's what made the difference to Nicole. When Nicole had to deal with an ACA plan, my bill's $15,000. When I had a group plan, my bill was $4,700. When I had Eagle Care, my bill was $400. Well, I can tell you, if I had to choose one of those, I know which one I would choose. I know which one Nicole's choosing, and I know which one that Will and Mike Strother chose for their company.
Yeah, Harlan, I'd like to say there's not a company that deals with 1099s that shouldn't call us. I mean, they really need to check this out.
Absolutely.
And small companies with W-2s like you were talking about. I mean, if you're Google's not going to call us, okay?
That's a lot of paperwork right there, too, Will.
I doubt Amazon's going to call us. But if you're not one of those two, you
know
may
what?
want to call us.
They should.
Well, I agree. We can solve their problem.
They should.
Oh, heck yeah.
Because they still got the same problem that the little air conditioner down the street's got 10 employees. They got the same exact problem.
Right.
They still don't have the participation. Now, the good news for them is because they're big, they do get lower rates because it's spread out over more, but they still have people that can't afford it. And more importantly, just like many school teachers out there, if you're a school teacher, you're fixing to relate. And that is, you can possibly afford to put yourself on your insurance, but you cannot put your family on it because they don't cover a person on that. And now, all of a sudden, you got a mortgage payment for your family. Well, guess what? We do have some individual options available on Eagle Care too, and we can help you even if you're not a group.
Great point.
Well, and on those small businesses, we've run numbers where, minimally we might save a small business $75,000 a year. Mm-hmm. And it could be $200,000, depending on how many employees. That's a lot of money coming back.
Absolutely.
Into the profit margin.
It certainly is. And that's one of the things I think a lot of folks don't even think about. They don't realize those options are out there. And I hope if you're listening today, or if you know someone that could benefit from that you'll tell them about us. And let us show the difference that we can make on their bottom line. There are a lot of things out there that will confuse you, a lot of things that will muddle. We're just going to give you the facts. We're just going to show you what your options are. And I sure appreciate everyone out there listening today. Don't hesitate to contact us. 512-559-4358. 512-559-4358. EagleCareHealthSolutions.com. Thank you, Mike. Thank you, Will. Thank you, Nicole.
Good to be here.
Harlan.
See y'all from Dallas next week. We're out.
Thanks for tuning in to today's edition of the Health and Wealth Power Hour with Harlan Pickett. And don't forget to tune in each Thursday at 1 p.m. to find ways to access and keep more gold for your golden years. Because what it's all about is really enjoying those years and never running out of money on the Health and Wealth Power Hour right here on AM 700 KSEV.